Hi, this is Dr. Suman, past chairman of KRSSDI. We have with us here Dr. N Manjunath, who is a well-known cardiologist, a member of parliament with us. Thank you, sir. Thank you for accepting and being with us for this wonderful conference. Sir, what is your take? How do you feel that conference of Treat Diabetes is going on?
See, today, diabetes is no more a disease of elite class or urbanites. It's equally prevalent among the villagers, poor people, laborers. So, diabetes is nowadays it's not a disease, it's a disorder affecting nearly 15 crore population. So, in this context, this particular conference, Treat Diabetes Mellitus, Treat DM 2025, is a well thought concept because their theme is it should be a translational conference. That means bringing clinicians, scientists, and technologists under one roof so that there can be more innovations. And that means it's basically theme is from science to solutions. So how best we can make use of basic sciences to come out with some specific solution. It could be a management strategy, it could be a drug development, or it could be some sort of a vaccine. I think definitely because diabetes today it affects the entire vascular health of an individual. So diabetes was one of the important risk factor for stroke, heart attack, peripheral vascular disease, chronic kidney disease. You name an organ that is being affected. So certainly we need research, and because there are various issues. Of course, some diabetes is autoimmune. Type 1 is autoimmune. Type 2 is insulin resistance. And interestingly, malnutrition or undernutrition can also cause diabetes mellitus because in middle and low income countries, particular third world countries, of course, India is now in middle income group. So we still see malnutrition. So because see, on one side, obesity, overeating causes diabetes, and undernourishment also causes diabetes. So and also we have to see because what is happening till now, the clinicians, researchers, and scientists are engineers. They were working in piecemeal in different locations, different platform. So bringing all of them under one roof will galvanize the research, and the also will come out with some solutions. And certainly in this conference there were a lot of young doctors, so this will be a great learning process for them. And because we have to treat diabetes properly, optimal management of diabetes can bring down the various adverse events, and the various target organ damage can be minimized.
Sir, how about generally what happens is most of the diabetic patients always get into the cardiac problems quite often, and youngsters are also we are seeing a lot of late. What do you think? Where we could really, step in and ensure that we prevent all this actually?
Now, one is probably we have to take, I mean, basically, it is a lifestyle
Yes.
disease. So you have to address those lifestyle disease. Your food habits, your food products has to be proper. It has to be a balanced diet. It should be a low calorie, low fat diet. And we popularly say you avoid 6 S. That is salt, stress, spirit, smoking, sedentary activities, and salt. You have to take care of those things. Not that you should not eat salt at all, but it has to be less. So I think, and stress management is very important. Your body weight management is weight reduction, and your body weight circumference, all those we have to keep it as low as possible, I think. And another important thing, sometimes environment also plays an important role. For example, air pollution, because you may be born with good genes, but environment, stress, and behavioral pattern can also adversely affect the genes and all. So, and most important, uh, one has to focus on your again diet. You should have more fruits, more vegetables, and the you have to properly plan your work profile also. So even if you are a, into a stressful job, you have to balance between your work and body, and ultimately you have, because you are owning your own body. So your companion is not your friends, or your companion is not your husband, wife, or children. Your companion is your body. So taking care of your body is your responsibility. And most important, because the burden of diabetes and all lifestyle diseases is so high in India, so men above 35 and women above 45 should undergo periodic checkup. You can call it as medical checkup anniversary or whatever it is. So early recognition and a very optimal evidence-based management is very, very important. You should not ignore those things. And because diabetes now you can of course now we have to treat in such a way, we have to educate patients to take care of themselves for smaller things, and only when they come out with some major issue they can consult the doctor. So self management education is a must for all diabetic patients. Ultimately you have to train them in such a way, the diabetic patients should become mini doctors for themselves.
Thank you so much. We have been listening to Dr. Manjunath. It was wonderful. Thank you so much for the insights.
Thank you.
Just a minute.